my name is Arianna and I'm a fourth year nursing student at Queen's University, and I'm going to be showing you what a 12-hour clinical day looks like for me, so enjoy!
At 5:15, I wake up and get dressed and gather my things. I wear my scrubs to work and wear a long sleeve underneath or a zip up over top. These are my absolute essentials that I make sure I have in my backpack before I leave my room. I eat my breakfast at 5:45, which is always a coffee and something that will really fill me up for the beginning part of my clinical day. I then go brush my teeth, grab my lunch, which I packed the night before, and I'm out the door at 6:15. I walk to the hospital, which normally takes me about 10 to 15 minutes, and it is absolutely essential to listen to some pump-up jams on the way. Sorry for the crazy shakes in this video, I was really on a roll, but I do love this walk in the morning because it is so quiet and beautiful and just allows me to clear my head before the start of the day. Once I arrive at the hospital, I put on my sneakers, put my stethoscope in one pocket, put my notebook in another pocket, and then my pen, which can write in blue and black ink, in another pocket. At 6:45, I'm ready to head up to the floor, and unfortunately, I can't video the clinical day, but I'm going to tell you more about it in just a little bit. I get 3 breaks throughout the day. My first is at 10 o'clock, where I have a snack of water, granola bar, and a mini orange. As tempting as it is to have more coffee, I try to drink more water than coffee just because I know it will help me in the long run. During my second break, I eat a meal which can vary, but I always try to eat things that will keep me full for a long time. So today, I'm eating water, coffee, another mini orange, some popcorn, and a lentil and quinoa salad. This doesn't look like much, but I promise that it's a huge portion of lentils and quinoa, and it tastes delicious. At 4:30, I have my last break, where I eat the popcorn that I didn't finish and an apple, and more water. Another food that's really important in my clinical day is chocolate, which I eat at every single break, but I totally forgot to bring it today. At 7:15, I'm all done for the day, so I walk on home.
Hi! So it is definitely really hard to take a lot of videos about what happens during a clinical day, but I think it's really important to kind of talk about what happens and some tricks and tips and advice and things, just because clinical is definitely the most nerve-wracking and stressful part about being a nursing student, but it's also the most exciting and rewarding. We can talk about a couple of things. So first up is what happens during a clinical day. And honestly, that is the hardest question to answer, just because it really depends. So a lot of it is going to depend on what floor you're on, what setting you're in, whether that's hospital or community, and then also what kind of patients you have and what skills you're able to do. So the nursing responsibilities, though, are giving medications, doing different types of procedures and assessments, really kind of collaborating with the healthcare team, and communication is a huge one too. Basic care for patients, so like bathing and changing, and also just looking after their general well-being. So that's a really big answer to what happens in a clinical day, but you can expect to be a part of all of those different things as a nursing student. Okay, so the next thing I want to talk about is fuel and energy. So these are 2 really important parts of your clinical day, and they come in 2 main forms, which is sleeping and eating. So for me, I'm definitely a nervous sleeper, so I never have a good sleep before a clinical day, but I try and do my best to kind of help myself fall asleep. So I'll read instead of watching TV. I'll go to bed at a normal time, not too early. I'll do things during the evening that will either help me prepare or distract me. Next part is eating. And it's really important to me that I give my brain and body as much energy as humanly possible. So I definitely eat more during a clinical day than I would on a studying day, but that's really important to me because I want to make sure that my brain and legs and arms and everything has all the energy that it needs to be able to get through my day as well as I possibly can. And also, I just find that when I am full and have all of that energy in me, I'm just a lot more confident and capable, which really helps me feel more comfortable in the clinical setting too. Next, I think it's a really important point to touch on is just a reminder that you are a student. You are there to learn. Don't go in expecting to know everything, because guaranteed you won't. Go in expecting to learn what you don't know. And I think that's a really hard part of the clinical experience for a lot of students, myself included. Even by the time that you graduate, you aren't going to know everything, and you will continue to learn throughout your entire career. So never hesitate to ask for help. Again, remember you're a student, you're learning, and everything that you don't know is that learning opportunity, and everything that you do know is just a bonus. Okay, and then the last thing that I want to touch on is that at the end of your clinical day, give yourself a huge pat on the back. You just had a really long day and did so many great things, and you learned so much. So go home, rest, relax, re-energize, have a really good meal, refuel, and do something that you really enjoy doing. So I'm going to take you along with the rest of my clinical day. We're going to go back and hang out with my housemates, eat some dinner. So thank you for watching, and I hope you enjoy the rest of my day.
I arrive back home at 7:45 and I quickly do my lunch dishes, then I hop in the shower. At 8:15, I eat dinner, and I normally would eat pasta or something easy, but I was really tired and had leftover sushi instead. During dinner, I spent time with my housemates, chatting and playing cards. At 9:30, I started getting ready for bed. So I brushed my teeth, took care of my skin, and felt ready to go to bed. So I read my book until 10 o'clock, which was when I turned my lights out because I had another clinical day to look forward to tomorrow.